Good evening. Hi, I'm Mick Raich. I'm the CEO of Vachette Pathology and Stark Medical Auditing. I want to start off with something fun today. This is a letter to a young man I play hockey with, Gavin. He's a family member who's in boot camp right now. And the rule is in boot camp, every letter you get, you have to do 25 push-ups. So I make sure I send him at least 1 or 2 letters a week. And all the guys at hockey now are sending him a letter too. So he's getting about 6 or 7 letters a week on top of all his other work. So that's how we take care of each other in the hockey world. A couple things that are going on in the world today. I want to give you kind of an update. Got some interesting things. First things first. Here we are, September 13th, and Medicare made a change to the ABN here as of August 31st. If you're not using the right ABN, you're going to get denied. So take a look at your ABN now and make sure that all your referring providers are aware of this change and they have the updated form. It's going to be important. Second, when we talk about how's the nation doing, how we see it, our groups are back working very hard right now. Unemployment, I guess, nationwide is around 8%. And we're seeing the nation, this note here talks about consumer confidence is up to 90.78%, which is really good. It's the best it's been since March, since late March. So the economy's rolling along, people are getting along. We're learning how to deal with this pandemic and move forward. But the question is, has healthcare moved along? And one of the things we're seeing is this change in healthcare that's can be kind of drastic because the way the money flows, it's going to be 2 or 3 quarters behind. We see, January, first quarter 2021, second quarter 21, maybe even first quarter 2022, there's going to be some big changes because healthcare systems, their operating margins have been drastically affected by this, even with the CARES package and the $50 billion that was added. So look for some things going on out there that might affect your lab. There might be a way to develop a partnership. Maybe your pathology group can work with some people. Maybe now's the time to look at joint ventures because in this time of stress, there's also a great time of growth. And there's some great opportunities there. One of the interesting things that I was reading said that roughly 59% of U.S. adults oppose being charged extra for businesses that were recouping pandemic-related costs. And 16% they've already paid a COVID-related fee for these costs. And in our world, in the lab and path world, and some of the other specialties we work with, we've seen some interesting changes. We've seen some billing companies do some rather interesting things and try to take advantage of this pandemic in a negative light and charge for money that they didn't actually collect. And on Vachette, what we did on our end, we knew our practices and our labs and our health systems were struggling, so we offered everybody a 50% off their bill. And that was a really interesting thing for us. So our groups, our labs, our practices, our health systems will not pay a COVID-related fee. In fact, they got a COVID-related discount. And if something happens this fall, we're here to do that again. It's going to be really interesting to see how things go forward this fall and whether we have another shutdown or before the election. What does October bring? Do we shut things back down? We know there's not going to be a stimulus package right now, probably before the election. But if there's another shutdown without a stimulus package, without another PPP loan or CARES package, we're going to catastrophically hobble most of healthcare and most of businesses in America, and it's going to get really, really ugly. So when does that relief package come? I don't know. If the politicians get done playing tug of war sooner rather than later, maybe we get something. But if they shut us down without giving us more relief, it's going to train wreck everything. And I think everyone, both sides of the aisle, will agree on that. A couple other things we have coming down the pike. What about this? What happens if you were a group that got capitated payments during the time of COVID? So your payments, you were paid per member per month. So you didn't see any members, but you still got paid. We're seeing some practices that had this capitated arrangement actually did very, very well. They didn't have to take huge cuts because it's a per member per month deal. It's not built on utilization. So, you can argue that COVID testing has driven utilization out the window. Yet, if you had a capitated practice, you did fine during all this. It was an interesting business model. Last thing I want to talk about, a couple things coming up this week. On Tuesday the 15th at 12 o'clock, we'll be working with the DARK report and doing a kind of a review on some of the business things you have to look at from a financial point of view for your lab. We'll actually have graphs on there and some of the things we're seeing in collections and AR, some really unique stuff going on out there in the billing world. So come to that. It's a half hour, and it'll give you some interesting things, interesting places to look. And then on the 16th, we're going to be working with the Executive War College, doing a virtual roundtable answering questions on COVID billing. We have a lot of groups that are wondering how to bill COVID, how to collect COVID, what are the denials like, what are the portals like, how do we handle it, what happens when the public health emergency goes away. We talked about this last speech on October 23rd. How are we going to handle all those denials? So join us this week. If you got a few minutes on a webinar, we'd love to chat with you. If you have questions other than that, feel free to hit the number below. We'll do our best to help you out. Again, I'm Mick Raich. I'm the CEO of Vachette and Stark Medical Auditing, and I'd love to chat with you. I hope things are going well. Stay safe.